Leaders' questions. I call on Deputy Micheál Martin.
Thank you, Ceann Comhairle. Tánaiste, the ongoing revelations concerning the establishment of Irish Water are making a lot of people angry out in the community. And people have been extremely surprised by the drip-fed of revelations over the last number of days. And it's fair to say, Tánaiste, that since the government set up Irish Water, it has until recent days been run like a secret service, with very little information being given to anybody, and particularly to members of Dáil Éireann and the general public. Now, you yourself said it seems, if one is to judge by the ministerial reaction, the colleagues of Minister Hogan, they seem to be as surprised as everybody else about some of the revelations. We don't know if that's fair or not, but clearly you yourself said last week that the 50 million, for example, that was spent on consultants, that value for money would have to be shown. And that it was necessary. Now, despite the last 2 days, we still don't have full details in terms of all of the spend in relation to Irish Water. And I think Minister Hogan's arrogant attitude of "it's none of my business" has really annoyed people and made people particularly angry. And also, could I put it to Tánaiste, that people are particularly worried at the news today that families with young children could be facing a second tier of charges, given the proposals that the regulator may have, and that they'll be particularly vulnerable to excessive water charges. And the way that it was established as a subsidiary of Bord Gáis has led to really a convoluted quagmire. And that's why, for example, it was revealed yesterday that bonuses will be paid to the staff of Irish Water, despite Minister Burton saying that would be astonishing. Despite Minister Hayes saying, he said it was a PR disaster 2 days ago. Yesterday he said paying bonuses would not be justified. The Taoiseach spokesman said the same yesterday. There would be no bonuses paid. We learned last evening, yes, bonuses will be paid. And the government approved the payment of bonuses. And the Economic Management Council approved the structure of the establishment of Irish Water as a subsidiary of Bord Gáis, resulting in the reality of bonuses being paid. Now, I accept, Tánaiste, in fairness to you, that the establishment of Irish Water was a Fine Gael policy with its origins in the New Era document. But that doesn't explain everything, Tánaiste. And I would ask you to explain to me today, why did the government agree to pay bonuses to the staff of Irish Water, and that would be part of the regime in Irish Water, despite everything we've heard from ministers? And secondly, if you could indicate to me, how is the government going to intervene to protect families with young children from excessive charges of €400 plus, given the role of the regulator, and also given your own stated position that you were against water charges? You said, I am against water charges. They are an essential service that should be provided as a public service. That's your own statement on it. And I would ask you if you could answer those two questions, please.
Tánaiste.
Well, there are quite a number of things, Deputy Martin, that I have to correct in your statement. First of all, Irish Water is being established to modernise the way in which the water services of this country are delivered into the future. I said, and the Labour Party has said for quite some time, that the delivery of water in this country needed to be done on a national basis. Nobody, for example, now would consider that it would be desirable, for example, that you deliver electricity on a county-by-county basis. And it is not sustainable that water services are delivered on a county-by-county basis. It needs to be done on a national basis, and that's why Irish Water was established. There are establishment costs associated with Irish Water. They run to about 1% of what the total cost of water service delivery will be over the course of the next decade. The amounts of money are very large. Of course they are. And that is why it is essential that there is value for money, for any money that is spent in the establishment of Irish Water, as there would be in the establishment of any company. Secondly, it is essential that there is transparency for that, and that is why the management of Irish Water and Chief Executive of Irish Water was before two Dáil committees this week to provide the information about how that money is spent. And secondly, it is also why the government is applying the Freedom of Information Act to Irish Water, so that the public can have full information about what is spent. it's also important that there is accountability in Irish Water, as in any public body, for the way in which it does its business. The Chief Executive of Irish Water was before two committees this week. And if any issues, it's the job of members who are elected to this House and who are members of the relevant committees, in this case Deputy McCarthy's committee and the Public Accounts Committee, to establish what the facts are and any information that they want. And if there are any issues that are surfaced in that process, then government will certainly be very happy to address them. The story this morning that there is some, the story this morning that there's some kind of a second tier of charging for families with children has no basis. No decision has been made in relation to the levels of charges that will be applied and how they are going to be applied, other than the policy that the government has taken, which is that the charging for water will be on the basis of a metered regime, will be on the basis of there being a free allowance for households, and charging to be above and beyond that. The process which has to be followed for that to be established is that the regulator has to set out what kind of charging on an economic basis is to be pursued, and then, based on what the regulator has said, the government will then make a decision as to what the level of the free allowance, water allowance, will be, and what charging then based on above and beyond that will be. That's the approach that we're going to take on it.
Thank you, Minister.
Tánaiste, you deliberately avoided answering the question about the bonuses. I asked you why did the government approve the bonuses? Minister Rabbitt's Minister of Communications approved it. Minister Howlin has approved it as Minister for Public Expenditure and Reform, and Minister Hogan as Environment Minister did, although he's now passing the buck to Minister Howlin as per his comments yesterday. Could you please answer the question? Why did you as a government approve the payment of bonuses, and why do we have to listen to all the hypocritical rhetoric from Minister Burton, who said she's going to take it up with you and the rest of the cabinet? Was she kept in the dark? And you see, Tánaiste, that's the problem. No one knows what to believe. Nobody knows what to believe. And it's incredible. I just think it's really insulting people to say that all this information is available. The only reason Irish Water was before committees this week was because Sean O'Rourke asked the question. Dáil Éireann was kept in the dark for 12 months. Freedom of information explicitly excluded Irish Water. Explicitly excluded. It was not included in the bill.
Question, please.
And prior to Christmas, the Dáil debate was shut down. I think I know the reason, Tánaiste. The reason was basically, can we keep this thing under the radar until after the local elections in May? And that's why people are sceptical and angry. And so the first charge will happen the last quarter of 2014.
You're over time.
And the regulator will be a powerful force in terms of levying those charges. Yeah. And I don't accept I think we need far greater clarity and certainty for families in particular with younger children. But could you answer the question on the bonuses, Tánaiste?
Thank you.
In the first instance. There's a lot of more questions we can ask, but given the time limits we have, we'll continue with it. But we'd like to get straight answers.
Thank you.
Why were bonuses approved? And will the power of the regulator be vis-a-vis government in terms of levying charges?
Thank you. Tánaiste.
Well, first of all, you know very well, Deputy Martin, that pay in the commercial semi-state sector is a matter for the companies themselves. There is government. There is. Please listen to me.
Hold on. I mean, if you ask a question, listen to the answer. You might like it, but listen.
There is a decision. There is a clear government decision that chief executives, which reduced the pay of chief executives of commercial semi-state companies and ensured that no bonuses would be paid to them. On the issue of hypocrisy, Deputy Martin. No. On the issue of hypocrisy, because you talked about hypocrisy.
Sorry.
I mean, you of all people are in no position to come in here and to talk about spending in any state agencies. You commissioned. You commissioned 145 consultancy reports when you were Minister for Health at a cost of 30 million. You spent 220 million on the PPARS project, which never saw the light of day. Never saw the light of day. And meanwhile, Meanwhile, your government presided over a neglect of water services in this country, to the point where people in Galway couldn't drink the water because it was contaminated. You brushed it under the carpet. For the money you wasted, Deputy Martin, on consultant reports, you'd have established Irish Water 3 times over.
Thank you. Deputy McLaughlin, will you please stand up? Thank you. Just stay quiet. Thank you. I called Deputy McLaughlin. Thank you. Sorry. Would you please allow Deputy McLaughlin, please? Thank you. Would you please allow Deputy McLaughlin? When you have to learn to. Look, the rules of this House apply to everybody on all sides, and I'll apply them as long as I'm in this chair. Now, I've called Deputy McLaughlin, and I expect the courtesy to allow him to speak. Thank you.
Tánaiste, as you know, Letterkenny General Hospital was devastated by a flood last July. 40% of the floor space of the hospital was contaminated by the flood water. The response at that time from the staff and management, as those flood water was coming into the accident emergency department and running into the hospital, was nothing short of heroic. And indeed, Tánaiste, that heroism of the staff and management has continued since, with the extra hours they've had to work and with the establishment of temporary departments. Tánaiste, prior to the flood, myself and my colleague Deputy Pearse Doherty revealed that, based on the number of inpatients going through the hospital per year, Letterkenny General Hospital had the lowest hospital budget in the entire state, and the lowest number of allocations of medical staff. And of course, again and again, Tánaiste, patients have suffered in Donegal because of this injustice. Once again, as I speak, there is a crisis at the hospital's accident and emergency department. Such is the extent of that crisis that the INMO have said it's the worst conditions they've seen in 15 years. There are patients in the county and across the county being diverted to Sligo Regional Hospital. Tánaiste, I ask you, will your government remove the moratorium and allow the management of Letterkenny General Hospital to allocate the necessary nurses and medical staff to run the hospital effectively? Will you match the heroism, will you meet the heroism of those staff who have worked unbelievable conditions and hours to keep that hospital going? Will you meet them halfway and give them an additional allocation of staff to help them to do their jobs?
Thank you. Tánaiste.
Well, first of all, I do recall the flooding that happened at Letterkenny General Hospital. And I want to first of all agree with you, Deputy McLaughlin, about the heroic work of the staff at Letterkenny General Hospital. They have worked in very difficult circumstances, and they deliver a very fine service to the people of the catchment area. And indeed, I had the privilege of visiting Letterkenny General Hospital some time ago and seeing that work for myself. In relation to the funding of the hospital and staffing of the hospital, that of course is a matter to be pursued with the HSE. As far as the government is concerned, the government is committed to maintaining the maximum amount of health funding possible in profoundly difficult economic circumstances, as we all know. And this year again, the HSE will have over €13,000 million available to spend. The amount that's available to the health service this year is greater than that budgeted at the start of last year. The government has met supplementary requests from the HSE to meet its requirements each year so far in the context of the overall management of the public finances. And the revised estimates that have now been published, it's the responsibility indeed of every department and every agency to live within the allocation. We were able to find, in the context of the revised estimates, 47 million extra in that estimate to give the health service extra to manage the delivery of health services. Now, the issue, obviously, that you raise about staffing, that has to be dealt with in the context of the Haddington Road Agreement. There are procedures that are provided for in the Haddington Road Agreement that address the whole issue of staffing and the requirements of individual hospitals, and that's something that has to be worked out between the hospital and the HSE within the framework that was agreed in the Haddington Road Agreement.
Thank you. Deputy McLaughlin.
Yesterday, the daughter of Myra Egonal, who is an elderly cancer patient, told the story of her mother. She was brought into the hospital at 5 p.m. On Monday evening last, and for 14 hours she waited in that A&E in unbelievable conditions to 7 a.m. the following morning. Another woman who attended the A&E department with her husband reported the following. The whole unit was swarming and heaving with people, patients, bodies and staff. Our hospital was completely overwhelmed. There were no beds available in the hospital, and the emergency unit was stacked to bursting. Tánaiste, they're just two stories. Both families praised the nurses and doctors to the nth degree, but it certainly wasn't them who failed those families and so many others. Tánaiste, your government's cutbacks and moratorium have led to this debacle. You know that, I know that, every TD in this House knows that. When are you going to remove the moratorium on vital frontline staff to prevent scenarios like these families have described? The dignity of their loved ones was taken away. That is no way to deliver a health service, and you know the reasons why. So Tánaiste, I implore you, you've talked about it. Everybody who knows about that hospital knows that the heroism was remarkable in keeping that hospital going. 40% of its floor space contaminated, unprecedented crisis for a hospital.
Thank you.
For them to have worked the hours they have done and done what they can, they cannot continue to be failed. They are literally at breaking point in terms of not just the A&E but other departments. Will you stand up now, remove the moratorium and stand by the staff and management of that hospital?
Tánaiste.
Well, first of all, obviously I don't know the particular circumstances of the case that you raised, but I will make inquiries about that. And I think because everybody in the country is entitled to get good quality attention and service when they attend a hospital. And I do know that the staffs of hospitals in Letterkenny and indeed other hospitals as well are extremely attentive to patients when they present, and they do an outstanding job, and I think the public, I think rightly, is in their debt for that. The staffing arrangements in hospitals was addressed during the Haddington Road Agreement, and that provided for changes to be made in rostering arrangements, and overtime arrangements and staffing arrangements generally. Some of that obviously has to be worked through at individual hospital level and worked through with the HSE. The provision is made, I think there is something in the order of about 5 million hours overall nationally that is to be worked through in discussions at hospital level and with the HSE. These arrangements have been agreed by all of the unions in the hospital and in the health service. It's now a matter of working those through and to ensure that the public get the attention that they deserve when they attend hospital, and indeed that the staffs of the hospital get the support that they need and that they deserve.
Thank you. Deputy Collins.
Tánaiste, I want to raise the issue of the latest cut to affect people with disability. On New Year's Eve, without any prior warning, a circular from the Department of Environment from a Labour Minister announcing cuts in the housing adaptation and mobility aids grants with immediate effect for all new applicants was issued. These changes in the income bands will have a serious impact, and I'll give you an example. If a household's income of 41,000, which is not a massive amount of money, they have 2 or 3 people working in it, will now have to pay 50% of cost of adaptation. It was previously 30%. This difference of receiving the grant of 21,000 down to 15,000. That is a cut of €6,000. The further decision of the inclusion of the entire household will also impede people's ability to apply. Now, we know what these grants cover, Tánaiste. They cover a range of adaptations, from stair lifts, from a ramp for wheelchair access, to a bathroom being used for a person with disability, to installing the ground floor toilet, etc. And these can make a difference between living at home, living in the community, or being put into institutional care. The claim that you've increased that amount available is a joke. Yes, this year it went from 35 million to 38 million, but the reality is there has been a 56 million cut since 2010, two-thirds of a cut since 2010, and this has led to significant waiting lists for these grants. Since 2008, people with disabilities have suffered cuts of more than 8% to the means-tested welfare payments, the respite care support cut, a 14% cut to essential health services. Tánaiste, would you agree that these cuts amount to an all-out assault on the hard-fought rights for independent living for people with disability? And do you agree that it is a further onslaught on their fundamental human rights?
Thank you, Deputy. Tánaiste.
Well, first of all, the allocation for these grant schemes in 2014 has actually been increased. The allocation in 2013 was 34.2 million. The allocation for 2014 is 38.4 million, and I think that has been reflected in the allocations that have been made to individual local authorities in the past couple of days. You are, of course, right that in many cases applications for these grants took a long time to process, and that's why when making the allocations last February, Minister O'Sullivan announced her intention to review the operation of these schemes to ensure that they are targeted at those who are most in need. The Department of the Environment, Community and Local Government requested the Housing Agency to establish a review group of local authority officials to review the grant schemes. The terms of reference were to examine the current housing grants and to make recommendations as to how the grants could become more focused and targeted at those who are most in need. Members of the review group included representatives from the County and City Managers Association and the Housing Practitioner Network, along with department officials and housing agency representatives. Consultations took place with organisations representing older people and people with disabilities. As I've said, the allocation this year is actually increased. Savings in the housing capital budget identified mid-year enabled the Minister to make additional funding of 2.2 million available in 2013, and it is the Minister's intention to apply the same rigour to her budget in 2014 and to use savings in other areas to make additional allocations later in 2014. Every local authority will receive additional funding this year. Expenditure will be closely monitored, and any savings arising will be reallocated to areas where the need is greatest. There are no changes in the Mobility Aids grant in terms of the maximum grant, which is 6,000, or the means testing for the grant. The maximum grant to cover 100% of the cost of works will be available to those with gross annual household incomes of up to €30,000. There has been no change to the maximum grant available for the Housing Adaptation grant for people with a disability, which is 30,000, or the Mobility Aids grant, 6,000. In the case of housing aid for older people, the maximum grant has been reduced from 10,500 to 8,000. It should be noted, however, that over the past 3 years, the average grant payment has been around 4,000, well below the maximum which is now available. For the Housing Adaptation grant for people with a disability and the housing aid for older people, the amount of income over which the grant is payable has been reduced from 65,000 to 60,000. While the age limit for eligibility for the housing aid for older people has increased to 60 to 66 years in line with the majority of supports for older people, a lower age limit can apply in certain circumstances at the discretion of the local authority. And this may happen in certain hardship cases or where guidance is provided by medical professionals.
Thank you. That's good. Deputy Collins, 1 minute.
It's a classic talking down the clock, Tánaiste. The fact is, since 2010, when there was €100 million in grant allocations for people with disabilities, has been reduced down to 35 million last year. There are huge waiting lists. That's a cut. And then tightening the criteria is another cut. No one applies for disability grants if they don't need it. And it's all assessed to the HSE, to the health boards, etc. Amnesty International have said that any cuts in disability is an attack on the human rights of the person disabled. You are standing over that by that answer you gave me. The Disability Federation Ireland came with their statement after this cut. Says a whole series of public policy documents and statements promise that people with disabilities would be supported to live in their own homes in the community. The draconian cuts in the funds for housing adaptations and the further restrictions issued in the Department of the Environment Circular on New Year's Eve belie that promise. By these measures, the Department is failing to deliver on the government policy of mainstreaming and community living. We strongly urge government to immediately prioritise the adequate funding of adaptation grants. You have stood over this for the last 3 years. You have, with the Taoiseach, before the election and in your manifesto, have said you'd make this a priority. You are continuing to cut the most vulnerable people in our society who need that care. You are attacking their human rights, and any amount of waffle will not cover that.
There is no cut in the maximum amount that is paid for people with disability or with mobility.
That's for older people.
The amount of money that is being provided for this year for these grants is increased. It's not reduced. It's increased on what was provided last year. Minister O'Sullivan has made it clear that last year, in addition to the money that was provided for last year, that she was able to find from savings and grants which weren't paid additional monies which she put into these schemes last year, and she has made it very clear that if she is able to find additional savings again this year, that she will be able to provide additional money later in the year. As we start 2014, let's be clear about this, as we start 2014, I think we can say with confidence that there are more people out there who are applying for these grants who will get these grants in 2014 than got them in 2013. Now, no matter how you twist and spin the story, more money is an increase. More grants is more people who are being addressed with these issues, and Minister O'Sullivan is absolutely right to introduce the changes which he has made to the operation of these schemes so that they can be targeted at those who are most in need of them, and secondly, that the inordinately long waiting times which many applicants had to endure for these grants because of the complexity of the schemes, that because of the streamlining she has done of the criteria that apply, that those waiting times will be reduced. So what we are looking at here is additional money for these schemes, more people who will qualify for them, and a shorter length of time waiting to have the application processed.
Thank you. That completes